common questions about HIV rash. What does HIV rash look like? Seroconversion rash, an early symptom of HIV that usually occurs within the first 2 months after contracting the virus. Many people develop flu-like symptoms and a rash. Seroconversion illness may also cause a fever and swollen lymph nodes. This HIV rash doesn't itch, and is usually flat and red. Like other initial symptoms of HIV, it's easy to mistake this rash for a symptom of another viral infection. Therefore, it's important to learn how to identify this rash and how to treat it. In addition to medication, some lifestyle changes may help alleviate the symptoms of the mild form of this rash. Avoiding heat and direct sunlight can improve some rashes. Hot showers and baths can make the rash worse. Is HIV rash itchy and painful? When people are first infected with HIV, they may experience an acute, flu-like illness called a seroconversion illness, about 2 to 4 weeks after being infected. The HIV rash is a symptom of this condition. The rash is not usually itchy and it tends to disappear within 3 weeks. Where does HIV rash usually appear? Whether caused by an HIV medication or by HIV itself, the rash typically appears as a red, flattened area on the skin that's usually covered with small red bumps. A main symptom of the rash is itchiness. How soon does HIV rash appear? Rash as an early symptom of HIV. A rash is a symptom of HIV that usually occurs within the first 2 months after contracting the virus. Everybody infected with HIV will seroconvert at some stage, but only about 80% of patients will notice any symptoms. Seroconversion usually occurs 1 to 3 weeks after infection, but could take up to 6 months. How long does HIV rash last, and how it goes away? The rash associated with seroconversion, which occurs shortly after infection, usually disappears on its own. Rashes caused by infections will go away with proper treatment. However, because HIV steadily weakens the immune system, an infectious rash may return. Cellulitis in particular tends to recur. The rash can appear anywhere on the body, but it will mostly be found on the face, chest and palms. It will probably last for about 2 to 3 weeks, and should not itch or be irritating in any way. The rash may appear as ulcers in the mouth, or on the genitals. Is HIV rash contagious? Yes, it is contagious. You can pass it to someone by touching their skin, sharing towels or linens, or touching the same objects. Typically, the bumps go away on their own. But they may be larger and harder to treat for people who have HIV or AIDS. However, treatments for the HIV infection can help by boosting the immune system. HIV rash treatment. The most common form of treatment to manage HIV rash is medication. Depending on the cause of the rash, over-the-counter drugs such as hydrocortisone cream or diphenhydramine may be helpful for reducing itchiness and rash size. More serious rashes may require prescription medication from a healthcare provider. Sometimes, starting a new medication, trying a new soap, or eating a particular food may coincide with the development of a rash. In this case, it's possible an allergy may be the cause. People living with HIV should contact their healthcare provider if they notice a rash and are not sure about the cause. Someone who is unsure about the cause of their rash and thinks that they may have been exposed to HIV should make an appointment with their healthcare provider. Let them know of any skin changes that have developed. This will help the healthcare provider make a diagnosis. Thanks for watching. Please give your feedback and don't forget to subscribe to Health Experts.